I want to welcome you to the second day. I really appreciate you getting up early, and I think it's missing David Cameron's keynote to come hear this, which I think you'll be really impressed by. So for those of you who didn't get to meet me yesterday, my name's Jill Gilbert, the producer of this show and our big Digital Health Summit at CES. I work with a group called Living in Digital Times, and really talking about the convergence of health and technology. That's everything from the grandest precision medicine projects down to a tracker you may wear on in your daily life. So thank you for joining us. Yesterday was an amazing day, mixing some of the most impactful entrepreneurs, healthcare experts, and patient stories. From Dr. Steven Steinhubble kicking off the day, sharing Scripps plans to embark on an endeavor to redefine healthcare with precision medicines, to the personal and heartfelt stories that Reverend Kevin Sauls and his parishioners shared on digital health and how it has impacted the lives of everyone with the help of Cedars-Sinai. So if you didn't get a chance to watch that, be here for that session. We'll be posting videos in the next couple weeks. Hopefully you'll get a chance. Hearing the patient stories is really a goal of mine, and I think that yesterday was such a treat. We ended the day on one of the most candid discussions we've heard to date on how pharma is really struggling to figure out how digital health's role, what digital health role will play in their world and what the future will hold. I mentioned yesterday that although we've been making huge advancements in digital health, hence our going vertical theme, the challenges are pretty great. Compliance, reimbursement, privacy, utilization, we're going to address all of that today. So today, let's do a little dive into what you'll expect. Here's a highlight. We're going to kick off with artificial intelligence and an out-of-the-box solution to help pharma confront some of their greatest challenges. We then move into something that many of you are facing. You've created a technology that's just better. You know it's better, and yet you're facing an industry of legacy systems leaving no room for you to fit in. What do you do? So we'll be really looking forward to a great talk and literally a case study of how they're confronting this. One company is. Medication adherence, $300 billion domestic problem, big issues for readmissions. I have some interesting facts later on that that Adherium is here to talk about. We then have a talk on partnerships and how they are impacting the healthcare space, followed by our first demo showcase of the day. We have 3 really impactful startups: Redox, Medable, and Narrative DX. We'll then invite a leader from the front lines for a candid conversation on everything from innovation and how they are tackling their biggest challenges from grand routes.
I'll do that myself.
And then,
Thanks so much.
Ooh, that was funny. Okay. Sneak peek at the afternoon. Lunchtime. Lunchtime's going to be very, very cool. We kick off with real lunch in a virtual world. We have 3 VR companies, all doing very different things, all in the sort of working healthcare space, coming to share with you their demonstrations on how it's impacting patients, healthcare systems, training, things like that. Another big birth of building clinical grade wearables. We've been, using these trackable, trackers and different types of wearables that aren't clinical grade, and yet we want to know when does accuracy matters, when doesn't it, and are we getting close to having a consumer wearable that is clinical grade. One of the coolest prep calls I had for this show was how AI is transforming all dimensions of healthcare, the proliferation of every facet of healthcare. It's become a part of every conversation I've had with almost literally every company. And then we rounded out with one of the most progressed areas in digital health, and that is digital therapeutics, featuring some of the most proven companies in the field. I promise you that. I was staggered by some of the results they shared with me. And then our last session of the day is actually a hands-on workshop. And it's really about designing for engagement. So using a medical device as our project and building it, how do we build this sort of stickiness into the project? So Zymedica, one of the leading advisory groups, probably in the world, but definitely in the country, they consult with many, many companies in helping them build sticky, engaging medical devices. So it's a real treat. So let's thank our amazing sponsors who are their continued support is appreciated. Zymedica, SeniorLink, ReSound, ResMed, Redox, RTC Media, and ISS. We appreciate your support. And thank you very much, as well as Plug and Play, which is out of San Jose. I don't know if any of you know that company, so or that group.